Oh Canada, home of hockey fans, the proud host of the 2011 Winter Olympics and cold winters that tells every Houstonian that we shouldn't be complaining over 38-degree weather in winter. When every Canadian during winter is waking up to piles of snow on their driveway and temperatures below zero, keeping them or delaying them from traveling to their destination. Even though Canada and the United States share North America, the two couldn't be any more different from each other in regards to healthcare and handling. Let's take a look closely how the two countries compare and are different from each other. As we know, the United States is a heavily private system while Canada is very different. In Canada is a single-payer and mostly funded system in regards to healthcare. A single-payer national health insurance is known as Medicare for All. It is a system in which a single public or a quasi-public agency organizes healthcare financing. The difference in Medicare definition between the word Medicare in Canada and the US is that Medicare is for everyone in Canada, while in the US it only covers the elderly. In Canada, most people receive their care through public funding. Most healthcare is free to those who use it without money out of pocket. In Canada, about 70% of the government pays for healthcare in Canada, while 30% is from private spending. But the healthcare in Canada does not cover care from prescription drugs, dental care, and eye care, so Canadians have to get insurance through their jobs or buying it on their own to get those services not provided by their Medicare. Most hospitals are publicly funded, and that's how the government is able to control healthcare spending in Canada, while most family physicians are private and operate on a fee-to-fee basis. This fact is what makes Canada a single-payer system, but not a country that has a socialized medicine system. This brings us into question. We learned that Canada has a completely different healthcare system than the United States. There is also a question of how their telemedicine network works in their country and how it's beneficial. While the need for telemedicine and e-health can be shown in some of the problems Canada faces in their system. One of them being is that more and more patients each day have to wait. One might wonder, well, healthcare in Canada sounds awesome. But in reality, it really isn't. Just because everyone in the government is covered, the flaws can be shown that Canada only ranks 10 above the United States in the delivery of healthcare, with the United Kingdom ranking number 1. According to Forest Research, one of the problems they face is a wait time for certain healthcare services. In 2013, Canadians face a 4.5 wait for medically necessary treatment after referral by a general practitioner. The Commonwealth Fund research consistently shows that how Canada has a longer wait time than other countries with universal healthcare. Let us focus on Ontario, Canada, one of the 10 provinces of Canada and the most populous provinces in the country, containing cities of Toronto, Ottawa, and how it's currently improving wait times and getting patients for the results they need without having the burden of traveling or waiting to see a specialist.
You might wonder, why focus on Ontario, Canada? Well, for starters, Ontario, Canada is responsible for spawning what the people of Ontario know as the OTN, the Ontario Telemedicine Network. This is an independent, not-for-profit organization funded by the government. It is known to be one of the largest telemedicine networks in Canada. The network provides access to care for patients in every hospital and hundreds of other healthcare professionals and places across the province of Ontario. It also focuses on delivering distant education and meetings for healthcare professionals and patients. The OTN has numerous programs from Aboriginal Health Access Centers, e-consult, mental health and addictions, teleburn, teledermatology, telehome care, teleophthalmology, telestroke, teletrauma, and TMLHIN nurse program, which can all be seen on their websites. The OTN also has services from contact center and scheduling, learning center, personal video conferencing, telemedicine directory, video conferencing, webcasting, and web conferencing. One of OTN's great programs is Mental Health and Addictions Program. The program enables access to care for more than 100,000 patient cases of mental health and addiction. This gives fewer burdens of travel and time for those seeking help and suffering through a disease or disorder. In this way, the specialist may communicate with the patient at their home or location without having to endure long waits, travel costs, and time away from family members or friends. In a study by Dr. Brauberger, he found that although in person is preferable, the program and telemedicine combined is a great advancement as the patient can wait for only 3 weeks instead of having to wait 6 months to see a specialist. He mentioned in his study of young children in psychiatry of 2013 about how much of a hassle it was for both the parent and child to see a specialist. Dr. Braunberger stated that before, children in his care would be flown south to Thunder Bay for his care, where they were distanced from their family, friends, and culture. Another service from OTN is telestroke. According to OTN, in Ontario, more than about 16,000 people will experience or have a stroke that could lead to possible death or a disability. According to studies conducted by the organization, a stroke burden can be reduced by implementing the use of a neurologic drug like TPA. Within the first 4.5 hours of when the symptoms appear, this lessens the consequences of stroke. The provincial telestroke program provides patients remote areas to life emergency care, where a patient can get the care they need without going to a hospital and not get the full care they need because they need an expert neurologist assessment when they are admitted. For example, if a patient needs a brain scan and needs an onset assessment, with this program, the OTN has now about 22 referring sites in its province that have served about 652 patients in the 2012-2013 year. 196 of those patients received TPA.
Aside from the two programs we mentioned, the OTN has developed many other programs from video conferencing and a program known as Teleburn, which is a 24-hour burn service that provides urgent and emergent care to burn patients. With this, patients are immediately driven to an OTN center that has a program and are treated through a burn specialist through a video conferencing network that connects to the Ross Teleburn Center.
The OTN video conferencing started in summer of 2012. This offers members an exclusive access to the service. It is a web-based software application that delivers in real time in HD quality for clinical care and healthcare education at one's convenience. It allows both parties to talk and communicate with each other in order to share patient-to-physician matter, educator-to-student matter, and physician-to-physician matter.
One of the programs by the Ontario Telemedicine Network is their dermatology program. It is where a physician takes a digital image of a patient's skin condition and sends it to a dermatologist through the OTN network. With that, a dermatologist reviews the information they receive and returns the diagnosis and the suggested treatment to the referrer. This makes it easier for both the patient and the provider without having to worry about the need to travel in a great distance to see a specialist.
The OTN's teleophthalmology is important in Ontario because early detection of a diabetic eye disease is important so one does not lose vision. In a OTN study, it stated that 380,000 diabetics have barriers to a regular eye screening, but because of OTN, many programs like the teleophthalmology improves the eye barrier. It provides patients with free retinal screening at convenient times at its easy accessible locations across the province. The way it works is the primary care or family physician technicians captures an image of the patient's eye and then uploads it to a secure central server, where the ophthalmologist checks the images of an eye and provides an assessment to the patient's primary physician, where they tell them if they need immediate treatment or not. The OTN Telehome Care is also an amazing service. Since 2007, simple-to-use equipment is installed into the patient's home and connected to a telehome care nurse, who monitors the patient's vital signs and provides constant update to the patient's primary care provider. In the end, the Ontario Telemedicine Network is a great service and telemedicine network. Its program is a system that connects a network of doctors, specialists, patients, and their families together, all through the system of sending digital images via online instead of the inconvenience of travel. This has benefited everyone in Ontario.
Now, after hearing all the programs Ontario Telemedicine Network has, you might begin to wonder why focus on this organization while there are other programs and companies that provide telemedicine and e-health sites in the province of Ontario that provide the same services. Well, for starters, OTN is one of the founding partners and biggest supporters since 2012 by helping launch what doctors and developers in Ontario now know as the organization called Hacking Health. You might jump to the conclusion Hacking Health is an organization where a bunch of rogue hackers are busting to secret databases and installing viruses and secret codes that can ruin the system. No. In fact, Hacking Health gathers a team of web designers, software writers, IT experts, and pairing them off with healthcare physicians from doctors, nurses, and researchers into creating and improving programs in the healthcare system. We went through class and further research on the textbook that programs and systems like NHS Direct failed because it's hard to navigate by users in the past. And many are trying to improve technology right now so everyone can understand and use it. Well, the organization Hacking Health wants to focus on improving and inventing new kinds of system and technology that can be used and beneficial to all. And also finding a way to secure systems, because we know a system that is outdated and not secure enough can screw people over. One of the people who help organize Hacking Health each year believes that gathering those from the technology aspect and healthcare aspect can help better improve everything. He says that the problem is that people in health know what the problems they face are, but they don't have access to the people who create those solutions. And those with the technology solutions can't really understand and get the healthcare system. Hacking Health is an organization that closes the gap between health and technology. Take the organization of Hacking Health as something like Shark Tank. Instead of inventing and proposing the next Ava the elephant that helps parents feed medication to their children, developers and healthcare participants over a period of weeks can invent things like apps and technology like iCaregiver, which helps and alerts patients about appointments, medication timelines, and when to take them. Now in 2015, in an 8-week conference between March 30 and June 2, those who've registered are now working on 40 different types of projects and teams to improve e-health and telemedicine, as compared to 2013 when they only had 19 projects. Teams right now are creating prototypes like immersive telehealth delivery robot that combines a tablet and a robot platform and trying to improve communication between a healthcare professional and a patient and engaging the patient to be more active in their health. Developing mobile apps such as Trigger, which enables people with memory impairment to relive past moments in context that can be collected on their phone. And things like medication apps that use QR codes so a patient can pull up information on their medication whenever they need to. Although Hacking Health is fairly new, those in Ontario know that every new piece of technology comes from an idea, and every piece of new technology can be improved over time.
In conclusion, Canada might have a different healthcare system than the United States, but they have provided its citizens in Ontario with great amounts of healthcare benefits. Not only is their healthcare system a great work in progress through Ontario Telemedicine Network, but being a government and a universal organization has helped patients and doctors communicate better. Patients can get the best care providers without having to go through so much hassle from phone calls to multiple health insurances, difficulties with weather, and other barriers that keep them from reaching their ultimate goal in healthcare and telemedicine.